Greetings to all. My name is Manusha 21DC119, and my group mates are Omshri 21DC130 and Dev Talanpur 21DC132 are going to present a project on predictive modeling of COVID-19 patient recovery using complete blood count data. Basically, we have written a research paper on this project, and as you know, COVID-19 that was recorded in Wuhan, China, in December 2019, so-called a disaster. So-called a disaster has been increasing worldwide. Our data set was we have collected a data set was for the research paper that was collected between 12th April and 31st August 2020 at Dhaka Medical College Hospital, Bangladesh, which is approved by the Hospital Ethical Committee. The parameters were there were 103 patients in which 61 died and 42 survived. The objective of this study was to develop and validate an early scoring tool to stratify the risk of death using the complete blood count data. This data set contains the individuals who were ventilated or not, who were died or not, and according to their age, sex, and their recovery status. They will present project definition and planning.
So, machine learning based key biomarkers among CBC parameters as the mortality predictors were identified. We have used a multivariate logistic regression, and a scoring system was developed to categorize patients in three risk groups: low, moderate, and high, for predicting mortality rate. Lymphocyte count, neutrophil counts, age, white blood cell count, monocytes, platelet count, red blood cell distribution with parameter were collected at the hospital, and these are the important biomarkers for death predicting and death calculating death probability. The CBC score was devised for calculating death probability of patient and was used to categorize patient in three groups: low, which is less than 5%; moderate, which is between 5 to 50; and high, which is more than 50. The area under the curve of internal validation and validation cohort were 0.961 and 0.88 respectively, and when further validated with external cohort of 103 patients of Dhaka, the area under the curve was 0.963. We have used Python libraries and machine learning for implementation. Our future scope is to increase the parameters, increase the biomarkers to increase the accuracy and efficiency of our model, and we will implement this model in application also. Further to Omshri.
So basically, our project is dependent on graph itself. So the first graph that we analyze is the recovering rate. So we have critical age as a parameter, which are divided into two parts. That is female and male. As we can see, in a female, a woman who is 30 plus have a higher recovery rate, and a male have a similar recovery rates. Next. As we can see in graph 2, there are comparisons between white blood cell and platelet counts. Here, the younger patient does not need that ventilation, then older people needs it. Next graph. In this graph, we have taken four parameters, that is white blood cell, platelet counts, neutrophil counts, lymphocyte. According to this, we have analyzed our COVID-19 reports. The last graph is most patient middle-aged or elderly. So here are 35 to 40 patient aged between this category are symbolized as a middle age, and a patient aged between 60 to 70 are considered as elderly. For the Manav will take over.
This is the snapshot of the data set we have used in a machine learning model, and this was taken from the Kaggle. In conclusion, logistic regression technique can predict the risk of COVID-19 patients with a good discrimination and calibration based on multiple CBC predictors. The model has a high degree of precision in the predicting the patient's outcome much earlier than the real clinical outcome. The model was tested on a completely unknown external data set. These are some references from which we have built up our research paper. Thank you.
Thank you.